Welcome to the deep dive. Wow, you've really sent us some incredible stuff this time. This material on the immune system, from basic immunology to the latest in oncology, is amazing.
It is, isn't it?
Yeah. So our goal in this deep dive is, to really pull out the most important insights about your immune system, how it works, how it's structured, its network,
Yeah.
the crucial jobs it does, every second of the day, what can go wrong, and the really incredibly promising ways we're now learning to use its power in therapies. I think you're going to have some real aha moments today.
Oh, I think so. Absolutely. What you've sent is a great starting point.
Yeah.
And it's clear that you're looking for that solid understanding of how it all works.
Yeah.
So let's do it. We're going to explore the immune system from its physical highways to its specialized defense forces. We'll even look at what happens when it gets overactive or needs a boost.
Yeah, absolutely. And the notes start off talking about the lymphatic system, which honestly always sounded kind of mysterious to me. But it seems like it's essentially the body's dedicated immune superhighway. Is that a good way of thinking about it?
That's a great way to put it. Think of it as a circulatory system that runs parallel to your blood vessels, but instead of blood, it carries lymph.
Okay.
It's a fluid that's crucial for immune function.
Okay.
This network, it starts with tiny, thin-walled lymph capillaries. And these capillaries collect fluid, now called lymph, from all of our tissues. And this lymph originates in the blood. It's rich in white blood cells, and it flows into larger lymph vessels. And these vessels, they have these one-way valves, which ensure that the lymph always moves towards the heart, much like the veins in your blood circulation.
Oh, okay. So this lymph superhighway has specific routes and destinations then.
Exactly. It travels through these key regions in the body where we find clusters of lymph nodes. And you actually mentioned several locations in your notes.
Mhm.
The cervical lymph nodes in the neck, the axillary lymph nodes in the armpits, the mediastinal lymph nodes in the chest. You also mentioned the mesenteric lymph nodes, which are around the intestines. You have the periaortic lymph nodes near the aorta,
Wow.
and the inguinal lymph nodes in the groin.
That's a lot.
It's a lot. And these aren't just like random pit stops. They're very strategic filtering stations along the lymph's journey. Ultimately, the lymph re-enters the bloodstream via two main lymphatic ducts. These are the right lymphatic duct and the thoracic duct, and they empty into large veins near the heart. And as you pointed out in your notes, this interconnectedness means all our body tissues are linked through both the lymphatic and blood vessel networks. It really is a truly integrated system.
Okay, that makes a lot of sense. So you said filtering stations, right? What exactly is being filtered out at these lymph node stops?
That is where the magic of the lymph nodes happens. They are densely packed with immune cells. You've got macrophages, and you can think of these macrophages as security guards.
Okay.
They engulf and digest any foreign invaders or any cellular debris. Imagine tiny Pac-Mans constantly on patrol.
Okay.
Then you have B-cell lymphocytes, and these are the specialized cells that produce antibodies to target specific threats.
Okay.
And then you've got the T-cell lymphocytes, which can directly attack infected cells or even help coordinate the immune response.
Okay.
So as lymph flows through these nodes, these immune cells are constantly scanning, looking for anything that doesn't belong. And it's really interesting to note, and you actually mentioned this in your notes, the lymphatic system also has this vital role in absorbing fats in the intestine after digestion, a slightly different but essential function.
Okay, so that makes a lot of sense. So that's the physical infrastructure, right? This amazing superhighway and its filtering stations.
Yeah.
So what are the immune system's main jobs then? I know the notes clearly outline three core functions.
Yes, precisely. First and foremost, it's the body's defense force. It's protecting us from this constant barrage of invading organisms, bacteria, viruses, fungi, parasites, anything that shouldn't be there. Second, it's like an internal housekeeper, maintaining homeostasis by removing damaged cells, worn-out cells from circulation, kind of like a cellular cleanup crew.
Okay.
And third, it's a vigilant surveillance system, constantly on the lookout for abnormal cell growth, which is crucial, of course, in preventing cancer.
Okay, so that's pretty amazing. And so we have this these natural barriers in our body too, right? As the initial front line of defense.
Absolutely. These are the physical and chemical mechanisms that work right off the bat to enhance our immunological protection. The notes give really great examples. Our skin, it acts as a physical barrier preventing entry. Eyelashes and cilia in our respiratory tract, they trap particles. The high acidity of our stomach acid kills many microbes. And the pH of the vaginal intestinal mucosa also inhibits growth. These are really the unsung heroes.
Yeah, that makes sense. So it's like, you've got the fence and then you have the guards.
Exactly.
So the immune system is constantly trying to distinguish, I guess, friend from foe,
Yes.
what
Yeah.
belongs, what doesn't. And that kind of brings us to this self versus non-self concept, which the notes call like the golden rule.
It's absolutely the fundamental principle of the immune system.
Yeah.
It has this amazing ability to differentiate between our own cells,
Mhm.
which is self, and any foreign cells or substances, which is non-self.
Mhm.
And when it encounters something that's non-self, it triggers an immune response to neutralize that threat. And that often involves antigens, which are substances that provoke the immune response, and antibodies, which are the body's highly specific defense molecules that target those antigens.
Okay, that makes sense. And are antibodies these like immunoglobulins I'm seeing here in the notes?
Oh.
IgG, IgE, IgA, IgM? Like what?
Yes.
This is a code.
Exactly, exactly. Immunoglobulins are proteins that recognize and bind to specific antigens,
Okay.
like a lock and key.
Okay.
And yeah, the alphabet soup, it represents these different classes. And each class has a different but really critical role in our defense.
Okay.
IgG is the most abundant in the blood and is very efficient at coding microorganisms. This signals to other immune cells to come and destroy them. Think of it as putting a target on the invader. Then you've got IgE, and IgE is the main player in allergic reactions.
Okay.
IgA, it acts as a guardian at our body's entry points. It's concentrated in tears, saliva, the linings of our respiratory and digestive tract.
Yeah.
And it basically prevents pathogens from getting in.
Oh, okay.
And then you got IgM.
Okay.
IgM is usually the first antibody to appear in response to a new infection, and it's particularly effective at dealing with bacteria in the bloodstream. It's fascinating that each immunoglobulin can be tailored to recognize a specific antigen.
That is pretty wild. So where are all these like incredible immune cells coming from
Right.
and being trained to do this amazing work,
Yeah.
The notes mention primary and peripheral lymphoid organs.
Yeah. So think of the primary lymphoid organs as the central command.
Okay.
The bone marrow is where all our immune cells originate, starting out as stem cells that can develop into various types. And the thymus gland is vital, especially early in life.
Mhm.
This is where T cells go through this crucial maturation process. They learn to distinguish self from non-self. It's where they become immunocompetent.
Okay.
And it's interesting, as your notes point out, studies have shown that removing the thymus early on can severely impair the body's ability to produce antibodies,
Wow.
really highlighting the importance of the thymus in establishing early immunity.
Wow. Okay. So bone marrow is the birthplace. Thymus is like the training academy. What about the peripheral lymphoid organs?
So those are the sites where the immune responses are actually happening.
Oh, okay.
The lymph nodes, which we talked about as filtering stations, are key here. They trap foreign substances and debris, creating a meeting point for immune cells to encounter those threats. The spleen is another big one. Think of it as a large lymph node, but for the blood.
Okay.
It removes old red blood cells, it filters the blood, and it's a site where lymphocytes can be activated during infection. It also stores blood, red blood cells, and platelets. And then you have the tonsils and appendix, which, though often overlooked, they trap and respond to pathogens that come in through the mouth and gut.
Okay, that makes a lot of sense. So we have like constant surveillance, a response happening throughout this whole network.
Yes.
The notes also mention natural and acquired immunity. What's the difference?
So natural or innate immunity is what we're born with. It's our inherent ability to respond to threats, and it's our immediate, non-specific first line of defense. It includes those barriers we discussed earlier, as well as certain immune cells. Phagocytes like neutrophils and macrophages, they're always on patrol, engulfing and destroying bacteria, clearing debris. And then there are natural killer cells, another type of lymphocyte. They can recognize and destroy tumor cells and infected cells without prior sensitization.
Oh, okay. Interesting. And acquired or adaptive immunity is
That-
something we develop over time.
Exactly. It's our body's more specialized, memory-based second line of defense. What's incredible about it is its specificity. It can target specific pathogens, and it can remember past encounters,
Mhm.
which allows for a much faster response the next time. And this acquired immunity can be divided into active and passive. Active immunity develops when our body encounters an antigen and creates an immune response, like when we get sick, recover, or get vaccinated. Even a stem cell transplant can lead to active immunity, as the recipient develops a new immune system from the donor cells. Passive immunity, on the other hand, involves getting preformed antibodies from somewhere else, like through antitoxins that neutralize toxins. or from a mother to her fetus during pregnancy, or even through immunoglobulin injections for immediate but temporary protection.
So, vaccines are a way of safely triggering our body to develop that active, long-lasting immunity.
Precisely. By exposing the body to a weakened or inactive form of a pathogen, or a part of it, we stimulate the adaptive immune system to make antibodies and memory cells. This gives us protection without causing the full-blown disease.
Makes sense.
And this acquired immunity really relies on two types of lymphocytes, B cells and T cells. B cells are the stars of what we call humoral immunity.
Okay.
They mature into plasma cells that make those all-important antibodies that neutralize antigens in body fluids. T cells, on the other hand, drive what we call cell-mediated immunity, which deals with threats inside our cells. And there are different types of T cells, each with specialized functions.
Mm.
You've got cytotoxic T cells, sometimes called killer T cells, which attack and destroy infected cells. You've got other T cells that secrete signaling molecules called cytokines, like interferons and interleukins, which regulate other immune cells.
Mm.
And then you have helper T cells, which are critical. They help B cells produce antibodies more effectively, and they stimulate the activity of other T cells and macrophages. Finally, there are regulatory T cells that help to dampen down the immune response once the threat is gone, preventing it from becoming excessive.
Wow. And what about dendritic cells? The notes mention that they present antigens and could maybe transfer immunity.
They are really interesting. Dendritic cells are messengers between the innate and the adaptive immune systems. They come from monocytes and are located throughout the body, acting like sentinels. They recognize, engulf, and process foreign antigens. And then they show fragments of those antigens on their surface, like showing a wanted poster to the T and B cells in the lymph nodes. And this antigen presentation is essential for activating the specific adaptive immune response. The idea of culturing dendritic cells outside the body, exposing them to tumor antigens, and then putting them back into the patient to prime their T cells is a really exciting and promising area in immunotherapy.
This is an incredibly orchestrated system.
It is.
Wow. So, shifting gears a bit, the notes talk about boosting our defenses through immunization and immunotherapy. We talked about vaccines, but what about this immunotherapy?
Yeah. So in allergies, immunotherapy means giving someone increasing doses of an allergen to help their immune system become less reactive. It basically builds tolerance and reduces the severity of allergic reactions. But your notes also talk about some groundbreaking stuff in cancer treatment, which is revolutionizing the field.
Oh, right. Using our own immune system to fight cancer.
Exactly.
Tell me more about that.
There are a bunch of cool approaches. Cancer vaccines are designed to stimulate the immune system to recognize and attack cancer cells. These vaccines can be made from killed tumor cells, parts of them, or cytokines that boost the immune response. Dendritic cell therapy, which we just talked about, involves taking a patient's own dendritic cells, exposing them to tumor antigens, and then putting them back in to activate T cells against the cancer. And then there are monoclonal antibodies, or MOABs, which are lab-engineered antibodies designed to bind to specific molecules on cancer cells, which can trigger destruction or stop growth. And in some blood cancers, like leukemia, especially after a stem cell or bone marrow transplant, donor lymphocyte infusions might be used. This means giving the patient T cells from the donor, which can attack any remaining leukemia cells. A powerful treatment, but one that needs to be carefully managed.
That's amazing progress. But what happens when the system, misfires? You know, the notes mention hypersensitivity.
Right. That's exactly what happens in hypersensitivity, where the immune system overreacts to something harmless.
Right.
This is what we call allergies.
Okay.
Your notes categorize these reactions into four main types, based on how they happen and the damage they cause. Type I, or immediate or anaphylactic reactions, is driven by IgE antibodies. Type 2, or cytotoxic hypersensitivity, involves IgG and IgM antibodies. This is what happens in blood transfusion reactions. Type 3, or immune complex hypersensitivity, also involves IgG and IgM. This happens in things like SLE and rheumatoid arthritis. And type 4, or delayed type hypersensitivity, is driven by T cells. Examples of this are contact dermatitis or transplant rejection.
So that, like runny nose and itchy eyes during allergy season, that's type I.
Exactly. Allergic rhinitis, which is usually triggered by things like pollen, mold, pet dander, dust mites, and ragweed, causes nasal congestion, a runny nose, sneezing, itchy nose and throat, and red, itchy eyes. We also see urticaria, which are those itchy red welts, and angioedema, which is swelling in the deeper skin layers, often affecting the face, lips, tongue, and throat. And the treatments, they focus on avoiding the allergen, using medications like antihistamines and sometimes corticosteroids to reduce inflammation. In more severe cases, epinephrine, like an EpiPen, might be necessary, and for long-term management, immunotherapy can be a good option.
And anaphylaxis? That sounds a lot more serious.
It is. Anaphylaxis is a severe systemic allergic reaction that can be fatal if not treated immediately. It can be triggered by various things like medications, hormones, insect stings, blood products, even some vaccines, and certain foods like shellfish, eggs, nuts, berries, even chocolate in some people. The symptoms can affect multiple organ systems: the skin, the gastrointestinal tract, and most importantly, the cardiovascular and respiratory systems. So we're talking hives, itching, flushing, nausea, vomiting, abdominal cramps, diarrhea, drop in blood pressure, dizziness, loss of consciousness, difficulty breathing, wheezing, and throat swelling. Treatment is all about securing the airway, giving epinephrine to constrict blood vessels, relax airways, and increase heart rate, using antihistamines like diphenhydramine and corticosteroids to reduce inflammation. Sometimes you need vasopressors to raise blood pressure and bronchodilators to help breathing. It's super important for people at risk of anaphylaxis to have an EpiPen and medic alert tag so first responders know.
Right. That makes a lot of sense. And the notes also talk about the risks with blood transfusions, like different transfusion reactions. It seems like, understanding immune compatibility is super important here.
Absolutely. This is an area where we need to be incredibly careful and understand the potential for immune responses. Reactions can happen to any part of the transfused blood. Febrile non-hemolytic reactions are pretty common, especially in those who've had lots of transfusions or pregnancies. It happens when the recipient's antibodies react to the donor's white blood cells or platelets. You might see fever, chills, nausea, headache, maybe a slight rise in blood pressure or trouble breathing. This usually happens during or within a few hours of the transfusion. Allergic urticarial reactions, where you get hives or a rash, usually happen within the first hour and are a reaction to proteins in the donor plasma. Then there are delayed hemolytic reactions, which can happen days or even weeks later. This is because of a delayed immune response to minor red blood cell antigens. It can cause a slow drop in hemoglobin and can be hard to diagnose.
And the acute hemolytic reaction, that one sounds really scary.
It is. An acute hemolytic reaction is life-threatening, resulting from a severe incompatibility, usually with the ABO blood groups. It usually happens very fast. Within the first 15 minutes, the symptoms are severe. Sudden chills, nausea, lower back pain, fever, a drop in blood pressure, vomiting, blood in the urine, or less urine output, and it can quickly become chest pain, shortness of breath, no urine production, and shock. And then there are anaphylactic transfusion reactions, which are rare but also serious. They involve rapid onset of gastrointestinal distress, cardiovascular collapse, and respiratory failure.
So the guidelines for administering blood must be incredibly strict, right?
They are. It starts with getting informed consent. You need a dedicated IV line, normal saline only. You have to check the patient's ID and the blood unit label, and 2 healthcare professionals need to verify all the information. There are time limits on how long the blood can hang. And, as your notes mentioned, you have to stop the transfusion immediately and call the doctor and the blood bank at the first sign of any reaction. You have to check vital signs constantly before you start, every 15 minutes for the first hour, then hourly, and again at the end. And how you treat a reaction depends on the type and how bad it is, but you always stop the transfusion and give saline. You might also give antihistamines, Tylenol for fever, epinephrine for allergic reactions, or steroids for inflammation.
Okay, that all makes a lot of sense. And lastly, the notes talk about transplant rejection and latex allergy. These both seem like situations where the immune system is basically just doing its job, right? Recognizing something foreign.
It's exactly. With organ transplantation, whether it's bone marrow, cornea, skin, kidney, heart, lung, or liver, the recipient's immune system might see the new organ as non-self because its surface markers, especially the HLAs, are different. This can cause rejection where the body tries to destroy the new organ. To prevent that, patients take immunosuppressants like prednisone, solomedrol, cyclosporine, and ATG. Unfortunately, this weakens their immune system and makes them more prone to infections. Transplants can come from living donors or deceased donors, and matching the ABO blood type and the HLA antigens is super important to lower the risk of rejection. And signs of rejection vary, but can include fever, weight gain, pain, feeling unwell, and swelling at the transplant site.
And latex allergy seems like a surprisingly common thing, especially in healthcare.
It is. Lots of medical products like gloves, catheters, and bandages contain latex. You can be exposed through skin contact, mucous membranes, even IVs, or breathing it in. Symptoms range from mild eye and nose irritation, hives and swelling, to serious breathing problems, and sometimes anaphylaxis. So if you have a latex allergy, it's super important to avoid latex and wear a medic alert bracelet to let healthcare providers know.
This has been such an informative deep dive into the immune system. It's amazing how complex and dynamic this system is.
Isn't it incredible? It's working all the time, protecting us, fighting invaders, even guarding us against cancer. It really makes you appreciate how powerful it is, how delicate its balance is.
You know, it really makes you think. The immune system is fighting this constant battle for us every second without us even realizing it. It really gives you a whole new respect for life, you know. If any of this, the lymphatic system, immunotherapies has caught your interest, definitely take a look at those sources you sent.
Thanks for joining us for this fascinating deep dive.